So I think at this point in time, everyone, for the most part, is aware of the importance of getting screening colonoscopies to prevent colon cancer, which is the second leading cause of cancer death. That being said, as a GI doctor who does thousands of colonoscopies, there is a myriad of other findings in addition to overt colon cancer that are relevant and often overlooked and underappreciated. Many of these findings can tell a lot about your underlying gut health, your microbiome, or even your overall well-being. In this video, we're going to break down 4 common findings on colonoscopy. That is polyps, melanosis coli, diverticulosis, hemorrhoids. What exactly are each of these? The implications for your gut health, your microbiome, and what does it say about your overall well-being? Hey, I'm Dr. Matthew Glover. I'm a clinical gastroenterologist licensed in 6 states, currently in clinical practice in Las Vegas, Nevada. Let's start with number 1, polyps, perhaps the most important finding. This is why we're doing a colonoscopy to begin with. We want to find and remove these polyps before they grow into eventual colon cancer. Not all polyps develop into colon cancer, but all colon cancer starts as a polyp. Think of a polyp as a growth on the lining of your colon or your rectum. In the same way that freckles on your skin can turn into melanoma, polyps in your colon can grow into colon cancer unless removed. This is why we say a colonoscopy is both diagnostic and therapeutic, meaning that we find the polyps and take them out all during the same procedure. This is the advantage that a colonoscopy has over, for example, a stool test. But it's important to note that not all polyps are created equal. Polyps are characterized by their shape, meaning that are they sessile, are they flat, are they pedunculated on a polyp? They're also characterized by their histology. When your polyp is removed, they send it to the pathologist to be examined under a microscope, and the pathologist sends a report back telling us, is it, for example, a sessile serrated lesion? Is it a tubular adenoma? Is it a hyperplastic polyp? Now, I know these are big words, and they are even to me now as a gastroenterologist, but it's relevant because the type of polyp determines your subsequent risk of colon cancer. So what do polyps say about your long-term health? Well, first and foremost, the characterization of the polyp in terms of size, histology, number, location determines your risk of developing eventual colon cancer. This is why your GI doctor takes all these factors into account when determining the duration of your repeat colonoscopy. I recognize it can seem like voodoo when your GI doctor tells you, oh, just get another colonoscopy in 3 years or 5 years or even next year. But there's actually very strict guidelines that take into account all these polyp characteristics that determine the duration of your repeat colonoscopy. Remember that we really only give 10 years in patients who have no polyps, have no history of polyps, and have no family history. Polyps can also tell us about your lifestyle, and by that I mean we really characterize risk factors for polyps in both modifiable and non-modifiable risk factors. Let's take the non-modifiable first. These are things you have no control over. Interestingly, tall people have an increased risk of polyps, males, certain ethnicities, and if you have a personal history of polyps or you have a family history, you can't do anything about that. But let's talk about the important things, and that is, what are the modifiable risk factors for colon polyps? There's a very good association between red meat and increased risk of polyps, tobacco, alcohol, all the good things in life. There's also a very good association between a lack of fiber in your diet, with fiber essentially being synonymous with fruits and vegetables. The more fruits and vegetables you eat, the less red meat you eat, the less polyps you're going to have. A second finding we often see on colonoscopy is pigmented colon. We call that melanosis coli, and that may have been the thumbnail that caused you to click on this video. This is a normal colon in the thumbnail, and this is a pigmented colon. We call that melanosis coli. As soon as I see that during a colonoscopy, I know immediately that the patient has a long-standing history of constipation for which they've been using stimulant laxatives. If you want a good overview video, click up here. I did an overview and a tier list of all the over-the-counter laxatives, the types, and which ones are the best to use. But suffice to say that when we see melanosis coli, I know immediately that the patient has a long-standing history of constipation for which they've been using the stimulant laxatives such as senna, which is X-Lax, or bisacodyl. The good news is that melanosis coli in and of itself is not harmful. It simply pigments your colon, and in fact, that can make it easier for your GI doctor to spot polyps and take them out. However, it shouldn't be ignored, and that's because it raises a second order question, and that is, why is the patient constipated in the first place? Typically, when I see patients with melanosis coli after a colonoscopy, I always arrange a clinic follow-up to discuss their constipation and why are they having that to begin with. We're looking for things like irritable bowel syndrome, constipation predominant. Maybe there's a pelvic floor dysfunction, a pelvic floor disorder, or maybe they simply need to focus on lifestyle in terms of more water and fiber. But regardless, melanosis coli, it's not clinically relevant, but it should, most of the time, indicate a need to work up their underlying constipation. Number 3, we have diverticulosis. I want you to think of diverticulosis as a structural abnormality of the colon. In the same way you can be driving down the highway and see cracks in the highway, this occurs over time in the same way that structural defects or pockets in your colon occur over time and with age. These defects usually occur in the wall of the colon where the blood vessels are coming through to provide nutrients and blood to your colon. At these sites where the vessels are going through the wall, it's a point of weakness, and pockets tend to occur over time. And we're not talking about one. Most patients have hundreds of these if they do have diverticulosis. Diverticulosis in and of itself is not harmful, but sometimes it can result in complications about things like diverticulitis, which is an infection in the pocket, or bleeding from the pocket, because the pockets tend to happen where the blood vessels pass through the wall of the colon. If you want a more in-depth video of diverticulosis and its potential complications, check it out in the playlist below. I made a couple videos on that. In terms of implications to your overall well-being and gut health for diverticulosis, it, much like melanosis coli, implies there's a long-standing history of constipation. The pockets tend to occur and enlarge when you are straining. So if the patient is straining a lot on the toilet over years to decades, they're going to have worsening diverticulosis over time, and that's something we focus on subsequently in clinic. But as summary, think of diverticulosis simply as structural age-related changes in the colon, and it may indicate a need to optimize diet and lifestyle in terms of increasing water and fiber to prevent constipation, which is the root cause. Number 4, hemorrhoids. I'm going to tell you a little secret, and that is almost everyone has hemorrhoids to some degree during a colonoscopy. It's only when they get large do we really start to worry. During a colonoscopy, we like to characterize the hemorrhoids. Are they internal, external, grade, degree, extent, etc.? Truth be told, hemorrhoids never killed anyone, so I only offer treatment if they're really bothering the patient. We can see things like itching, bleeding, prolapse. Treatment is usually banding the hemorrhoids or even a surgical hemorrhoidectomy in extreme cases. Hemorrhoids are more of a localized problem than a whole gut problem, but they are a localized complication of a greater issue. And whenever hemorrhoids are bothering patients, we always make a follow-up to address possible underlying lifestyle changes, or if they're really bothering them, I bring them back to clinic for hemorrhoidal banding. Hemorrhoids are probably the most common cause of bright red blood per rectum, but you should never assume as such. If you're having rectal bleeding, yes, it's probably hemorrhoids, but you should 100% get a colonoscopy to make sure there's not any cancer, polyps, or something more worrisome there. So overall, what do hemorrhoids say about your underlying gut health? It, in and of itself, is not a huge problem unless it's bothering you. That being said, it is a herald sign or a clue that perhaps your diet in terms of increase fiber, meaning fruits and vegetables, or increasing the water, shoot for about 3 liters a day, could use improvement. So big picture, let's step back for a minute and recap 4 of the most common findings on colonoscopy and what they may say or implicate about your underlying gut health. Number 1 are polyps. Remember that there's both modifiable and non-modifiable risk factors. There's a very good association between decreased risk of colon cancer, decreased risk of polyps by increasing the amount of fiber and water in your diet. Number 2, Melanosis Coli. This simply means you have underlying chronic constipation for which you've been taking stimulant laxatives over years to decades. Melanosis coli in and of itself is not clinically harmful, but it is a herald sign that the constipation, which is the primary issue, likely needs further workup. Number 3, diverticulosis, these pockets in your colon. Only a small subsect of patients will end up having problems with their diverticulosis. Most of the time, it's a benign structural change that's associated with age and perhaps constipation, but this is the most common finding on colonoscopy and is usually not clinically relevant. Number 4, hemorrhoids, typically not clinically relevant unless it's really bothering you in terms of itching and bleeding. But remember that all rectal bleeding is not hemorrhoidal, and unless you've had a colonoscopy to prove there's nothing else there, you should definitely get one done. Don't assume it's just hemorrhoids. Your colonoscopy reveals a lot. Some are warning signs that need to be addressed immediately. Others are simply things that tell us about your long-term behavior patterns, diet, and lifestyle. The key is understanding which category your finding falls into and making the necessary adjustments to avoid poor outcomes or progression of disease in the future. I hope you found this video interesting. As I mentioned in the video, you can check out the playlist below for more information on diverticulosis. And I also did a breakdown of all the most common over-the-counter laxatives, if you're interested in that as well. Which ones are best, which ones are not so good. Anyways, that's all I had for you guys, and I will see you in the next one.